Fall for sure, it's here, which means the weather is cooling down and we're in the flu and RSV time of year as well. You need to be in the know to make sure that you and your family are protected this season. So today we have Michael Cinoman, Dr. Michael Cinoman, Cone Health Pediatric Intensive Care Unit Medical Director, to tell you what you need to know about RSV. So let's just start out right there. What is RSV and what makes it different than like the flu or the cold or the COVID-19?
Well, hello, and thank you for having me. RSV stands for respiratory syncytial virus. It is a respiratory virus, as are COVID and the flu and other viruses that are very common in the wintertime. All that means is it's a viral infection, not a bacterial one. So we don't have antibiotics to treat it. And they're very common, easily contagious, and they cause upper respiratory tract symptoms in most people, but can cause lower respiratory disease in vulnerable patients, small children and adults. That means wheezing, asthma-like symptoms, and pneumonia.
All right, and so, kids get stuffy noses, kids get colds and coughs and things like that, but this is something that's much different. So let's talk about the health risks and concerns with RSV when it comes to those infants and young children.
Sure, most children actually will get what you just described, just a cold. RSV, there are about 4 million babies born every year in the United States. Approximately 2/3 of them get RSV. Of those children that get RSV, about 150,000 end up in the emergency department, 600,000 in their doctor's office, 50,000 are hospitalized, and 100 to 300 die from it. So it is very variable. Most commonly, it goes very smoothly. Children are a little bit miserable. They get a cold, a fever, a cough, congestion, but it can progress and develop into something much more severe for some children.
All right, we're going to talk about that progression and talk about some things that we can do to avoid that. To prevent RSV, there are vaccines available, including one that just recently came out to moms-to-be as well. So let's kind of talk about the vaccines for the kid and for the mom-to-be.
Sure. For the mother, there are 2 vaccines available, and the CDC does not have a preference between one or the other. They recommend them for adults 60 years or older, and it is what's called a shared decision making. It is not like some other vaccines where they simply blanket recommend it for everyone in the population. However, RSV for adults, I just gave you a lot of information about children, but the older you get, unfortunately, as an adult, the weaker your immune system gets, and you become very vulnerable. And there are hundreds of thousands of adults hospitalized with RSV every year, and probably 10,000 to 50,000 die from RSV every year, pneumonia and airway disease. So it is worth strongly considering talking to your doctor and getting vaccinated. The vaccines are very effective at preventing severe disease.
Okay, we talked about the vaccines for those who are 60 and older. How about when should a pregnant woman get that vaccine?
Great question. So that is also something that is brand new for this year. That same vaccine, one of the 2 of them, was studied in pregnant women. And the recommendation is if you are between 32 and 36 weeks of gestational age in RSV season, that you can get a vaccine. And what happens is not only are you protected, but the immunity that you develop, the antibodies, cross the placenta, and the baby ultimately gets protected from the moment they're born. They have antibodies that last 5 months into the RSV season. Also was found to be incredibly protective at preventing RSV, either medically severe RSV or even hospitalizations for children of mothers who got that vaccine.
And you said, so if they're in the season of RSV, but if they're giving birth, let's say in like April, May, June, July?
No, then the recommendation is different for those times of years. But so if you're 2 months, basically September through January is the recommended time that women consider getting it when they're 32 to 36 weeks of gestational age.
Are there any concerns with getting the vaccine for those pregnant women?
Not many. In the studies, there was a tiny bit higher percentage of preterm birth in the women who received the vaccine. We're talking about 5.5% to 4.5%. So there's always a significant risk, about 1 in 20 of delivering preterm anyway, regardless, just as a baseline. But it wasn't statistically important, but that risk is there. So again, it's something you'd probably want to talk to your obstetrician about.
All right, and when it comes to the kids, because we did over 60, we did pregnant women, when it comes to like infants and young children, what ages are recommended for like the vaccine?
Okay, now the children this year, we again have another tool for them, and it's technically not a vaccine. So what I've described for the mothers to get is an actual vaccine where they get a part of the virus and they mount an immune response. Same thing, so flu vaccine or COVID vaccines work the same way. Children, we have a brand new tool, which is actually an immune globulin, which we would consider passive immunity. So the baby is not mounting immune response, doesn't work the same way vaccine does. We're actually giving them the antibodies that would be developed after a vaccine is given, so it's passive. A muscular shot, it will look just like a vaccine. The dose will be similar to a vaccine, but a baby will have those antibodies in their system for 5 to 6 months after they're given the immune globulin.